Much, Honourable Speaker. In September of 2022, a friend received alarming news from her doctor. A test revealed abnormal cells necessitating an immediate biopsy. She called me because, contrary to the expected 2-week wait, 3 months elapsed before the procedure, which ultimately confirmed cancer. Initially informed of a minor emergency surgery that was to be scheduled within weeks, she then faced repeated postponements over 5 months. These delays disrupted her family life, leading to ultimately job loss. But worse yet, when the surgery finally occurred, it was significantly more invasive than it would have been had it been performed when it should have. This is just one example of how poorly women with cancer are treated in BC. Over the last 7 years, it's become painfully clear that the needs of British Columbian women, especially those battling cancer, have been ignored. Despite promises, there was no mention of improving access to cancer specialists or oncology services in the 2024 budget. No funding for vital infrastructure like the Kamloops or Nanaimo Cancer Centres to get care closer to home, and a deafening silence on addressing the urgent need for expanded cancer care services. This negligence is not just disappointing, it's dangerous. Our cancer care system was best in class 10 years ago and #1 in outcomes, but it has deteriorated to the point of becoming an international embarrassment under the NDP. And it's worse for women. Stories have emerged of women being directed to medically assisted death because they cannot access timely treatment. Women getting surgery for cancer but being put on wait lists to get on the wait list to see a gynecologic oncologist. Only 20% of cancer patients referred to an oncologist are seen within the recommended 2 weeks, compared to 75% in Ontario. The mean wait time for a first consultation with an oncologist has increased to 43 days, which is a 43% increase. The wait time for cervical cancer screening results in BC is 6 months. With only 8 gynecologic oncologists, British Columbia has the fewest of these subspecialties of any province in Canada. Average wait times for gynecological cancer specialist access at Vancouver General Hospital reached 99% out of range of the benchmark. And I'll quote from the Globe and Mail, from April to June, just 4.7% of patients with endometrial cancer on BC's mainland were able to have surgery within the target timeline of 8 weeks from diagnosis. Only 3.9% of patients with grade 1 and 2 tumors were able to have surgery within the target time of 6 weeks from referral, while no patients with grade 3 tumors were able to have surgery within the target time of 4 weeks from referral, end quote.
Noting the hour, member.
Women taking 7 months to get breast cancer diagnosis. Women choosing to travel to the US for surgery because they won't get treatment in time, but only if they can afford it. British Columbian women deserve
Noting the hour,
better.
member.
It's time for this government to step up to prioritize women's health and to end this crisis once and for all, before anyone else dies. Thank you, Honourable Speaker.